Hello, welcome to Health Matters, brought to you by the Allied Health Department at Hutchinson Community College. Health Matters is a presentation that keeps you up to date on the happenings in our Allied Health Department. I'm Loretta Horton, I'm co-chair of the Allied Health Department, and with me today is Gay Stack, who is a nursing instructor in the Associate Degree Nursing program.
Yes.
Welcome, Gay. Tell us a little bit about yourself and what you do at the college.
Okay. Sure. I'm one of the faculty in the Associate Degree Nursing program, which is here in Hutchinson. We are located at 815 North Walnut in the Davis Hall building. It's kind of behind the Quest Center here in Hutch. I have been teaching for the college. This is my 20th year to teach, and I've been teaching in the nursing program. I've basically teach the second year, which is part of their very specialty areas, and I happen to do peds, and then the second semester, or what we call spring semester, we do what we call crisis care and leadership. So that's kind of where I fit in, but I'm one of 3 members on that team, and have really enjoyed teaching nursing students and helping them build themselves professionally and gain a good knowledge base so they can be a safe practicing nurse out in the community.
Good.
So,
one of the things that I know that you're very involved with is something called HANDS.
yes.
What is that?
Okay, HANDS is the acronym for Hutchinson Association of Nursing Students. It has 2 main goals. One, to help them build to be a professional, and the second one is volunteerism and community support. So they become a member as soon as they enter the program. So all students are a member of HANDS. They elect officers. They do receive some support from Stuco, but they have fundraisers, and actually today we were working on who we were going to be helping over the holidays. So we were looking at some volunteer things, some things we were raising money for to donate to different organizations across our community. But the one thing we're revving up for is one of our volunteers things is the blood drive that's coming up here very quickly, and that's of course why we're here, to kind of help inform the community. But it's been going since 1996, so the students have been very active doing a lot of things over the years, and each year they kind of choose their projects that we work on.
Good. So yes, today we are here to talk about the blood drive that's coming up, so tell us a little bit about when it is, where.
This is our 4th year that we have helped with the blood drive, and so it's really excited about that. We affiliate with the Wichita chapter of the American Red Cross, and we will be doing that this coming Thursday, which is November 10th, and we'll be at the Parker Student Union in the basement, and we start at 9 and we finish at 3 o'clock, and then we clean up and we'll be done. But our association is with the Wichita chapter, so they have been our supporters since we are in that service area. Those are the ones that we work with. So very excited about having that opportunity to help our community and our surrounding communities that need blood products and things over the holidays.
Okay. Gosh, what does a person who's never given blood before have to expect when they come in, or what should they expect?
Okay. Well, first we do some screening. One of the things is they do have to fill out a form, kind of a health history. We do look at age limitations. One of the things is, it doesn't so much in our state, but in some states there are age limitations. Usually once you're 17, you can make a decision to give blood, and most people will give blood up to age 75. After 75, then they really need a doctor's release. If they're younger than 17, then they need to have permission from their parents, and some states won't let the 16-year-old donate, but here in Kansas they will with parental. So age-wise, that kind of is a pretty wide parameter. So, those are some things to think about. A lot of people worry about, what if I have health concerns? Well, we'll kind of just look at a few of them. One, right now we're in allergy season. People have allergies. If you're not running a fever and you don't have a major cough or congestion and you feel okay, you can give, even if you're taking over-the-counter drugs. So that's okay. People say, well, what if I have asthma? I'm also an asthma person. Even if you're on medication, you're not having breathing problems, you're well in control, that should not be a problem in reference to donating blood. So again, it's how you feel and if you're under control. And this is always a bigger one, and me being an older individual, it's blood pressure. Blood pressure, it needs to be in control, but it must be somewhere between 80/50 to 180/100, and you can still donate blood. Even if you're taking blood pressure medications, so that is something that you can still give. And like I said, if you're feeling good and the medications that you're on are acceptable. So there are a few that might cause some problems. Another big concern people worry about, young and old, is what if I've had cancer? Can I give blood? Yes, you can. If you have cancer of what we call of the blood, what we call leukemia, Hutchinson, or lymphoma, you're not eligible to donate. So, you can come volunteer and provide services to help with the blood drive, but you can't officially give. But other types of cancer, such as breast cancer and so on, if it's been a year since you've been treated and you're feeling well and you're doing very well and you want to donate, that would be quite all right. And so those are just a few limitations in reference to that. Another syndrome that kind of gets in there is chronic fatigue syndrome. And they really don't recommend that you give blood. It's just a kind of a chronic situation. You have a lot of fatigue, and you have to rebuild your blood cells, so it can actually make you feel a little bit worse. So we don't want to have you doing that. And like I said, as long as you don't have a cold, that you're running a fever, you should be just fine in reference to donating blood. A lot of us, another big disease that we think about is diabetes. And being diabetic, you're eligible to donate as long as you're feeling good, you're very much controlled with your diet, but you have to be sure that you're on what we call a non-bovine insulin, and people would know what type of insulin they're taking, and there are some of the oral meds that might restrict. So I'll be given a number a little bit later that you can call and identify any drugs that might hinder you from coming. But if you're good control, you might be eligible to donate. Another one doesn't come up as much, but it's dental work. If you've had dental work, there's no waiting periods for fillings and crowns and like that. But if you've had an abscessed tooth, we probably recommend that you finish your antibiotics, that you're feeling well, and that you will wait a period of time, usually 2 weeks after that is resolved. So you're feeling good, so if you're going to donate. And it's not that we all have dental problems, but it is something that does come up sometimes unexpectedly in reference to our health and that kind of things. So those are kind of some of the ones that we think about the most. So I think you have to kind of look at yourself. You got to look at, am I physically active? Do I go about my daily activities? If I take herbs, like myself, I take vitamin C, I take my vitamin D, those are not going to affect you. If you're a person who likes herbs, none of those are going to impact the ability for you to give blood. So that's kind of a nice thing to know that, oh, okay, that won't harm anybody else, and that's a good thing that I'm doing for myself. So those are some things we have to think about.
So general over-the-counter medications are probably going to be all right. If you take ibuprofen or something like that, then should be okay to give blood.
And most of us, young and old, are occasionally having an aspirin, a Aleve. I'm not advertising any product, but acetaminophen, ibuprofen, those are perfectly fine.
Okay, good. One of the things I'm wondering about is, will I know my blood type once I give blood?
Right, you will. You will. And actually, they keep record. You become part of their computer information. And sometimes if you have a very special blood type, they may not collect your blood the day that you might be on a call list.
What does that mean, a special blood type?
Okay. The most common, and that's what I have, is O positive. That's very common. And a large majority of our population is O positive. A positive is the next one. Okay, so those are the two most common types that are out there. If I'm to receive blood, I can receive O positive blood from somebody else, but I can't receive A positive because that would cause a reaction in my body. But if I'm a person who is O negative, now I said the other was O positive, that's the Rh factor. I'm O negative, I'm the universal donor. So if I have O negative blood, which is very valuable blood, I can be given to anybody that needs to have blood, and particularly in an emergency situation. So sometimes if they have people who are O negative, they will often call and say, can you come donate? We're a little bit short on that. You know, they kind of help reserve it. Now there's some that's rarer than that, and one of those is called AB negative, and that can be a very rare one. Another one that is not as rare is B negative and A negative, but AB negative is one of the rarest ones, and then of course there's all those kind of combinations. So you hear A, B, A, B, O, but O negative is a universal. So it doesn't mean that, you know, we're going to call you every month or anything, but sometimes they will reserve those ones because there's a smaller number of the population, and blood is only good for so long after you donate. And so it can't sit on the shelf for 6 months. So we have to use it in a designated period. And so we wouldn't want your blood to be wasted. And so if that's something very special, they would contact you and see if you'd be willing to work on, you know, for those kind of things. So that's kind of a nice thing to be aware of. But yes, you will know your blood type, and they actually will tell you what your hemoglobin is, high or low. And like I said, you fill out all the information, and then they have to verify that you're okay. But you're then in their community network, and so they know resources that are out there for any future donations. And the one thing, this is the holiday season we're going into. We're all so busy, and one of the things we find is our blood donors go down because we're all so busy. So that's one reason we choose now to have a blood drive, is because the holiday seasons is a low time for people taking the time to come in, because it does take about an hour of your time to come in and donate blood. And so, you know, we are busy. We work, we go to school, we have holiday celebrations, but guess what? This is the time people do get hurt in accidents, and our demand actually goes up where our supply doesn't always equal it out. So,
now this is also flu season. So some people may have had a flu shot and flu immunization. So tell us, can somebody donate if they've just recently had a flu shot?
You bet. There is no deferral when a person has received their flu vaccine, the H1N1, the pneumococcal, the HPV. There's no deferments on those. Even if let's say you cut your finger and you got your tetanus immunization. No, there isn't. There is a few that they do delay on. Particularly one is what we call the red measles or the rubeola, the mumps one, or one if you're going to go to another country and you have to have yellow fever immunization. The other one is if you've had your hepatitis B immunization, they want you to wait around 3 to 4 weeks, so about 21 days before you donate. So, and some of us might be receiving that series as adults, or even as young adults may have had that. So we need to stay aware of that. The other thing is looking at German measles, or if you've had chicken pox or the immunization to prevent shingles like in an older adult, they often will have you wait 4 weeks before you are able to give blood. So, so there's a few of those, but those can be easily answered on the questionnaire and that kind of things. Or you can even call ahead and say, would this hinder me? So.
Okay. What about someone who may have had hepatitis in the past? Can they give blood?
No, they can't. And actually, if you and I go in, they donate, and to donate, they will be testing for that. And if we would come up positive, they would let us know confidentially that we have that, and our blood would be used in another manner. It would not be given to somebody. But if we have had past, like hepatitis C, no, we cannot donate.
Okay.
So.
What about someone who's pregnant?
No, she's keeping another little one alive, and so she's sharing her blood at that point. And once she is delivered, that's no problem. They usually recommend that they wait a period of time postpartum before they, and give their bodies time to heal and adjust to having a new baby that's going to wear them out. So, but they can return once they're non-pregnant.
Okay. So. How about someone who's just recently had surgery?
Well, usually most doctors will say that they need to feel well, be healed, have no infection process, and back to their normal routine before they donate blood. If they happen to have received blood, because maybe their surgery was pretty extensive, they often will recommend that you wait a year before you give blood.
Okay.
So, you know, if you've had some major surgery, let's say somebody had gone in and had heart surgery, received blood during that, they probably would recommend a year before you would be giving blood to donate.
And sometimes after surgery, patients have to take a blood thinner. So tell us about that.
Well, a blood thinner is something that can impact us. Again, medication, some of those might prevent you from donating, so it'd be one that we would have to clarify if you were on one of those agents. So.
Okay. Anything else that somebody should be aware of?
Well, we have in our society now lots of tattoos and body piercings, and that is one of the ways that we're identifying who we are. But one of the things we have to be aware of is, did they go to a reputable place that used one-time sterile equipment that wasn't done in somebody's back, bedroom? If it's a reputable place and they know it was sterile, they can donate. If they have a question of that, we recommend that they wait a year before they donate. So I know we sometimes, have those things done, those kind of things, those are some issues that we have to address. This also applies to acupuncture and electrolysis, where we remove body hair. Again, if you're with a physician who does that, those are probably done under sterile technique, probably not a problem. But if there's any question, we probably would recommend that you wait a year. So. Good.
How much blood is actually going to be taken from someone?
Well, I brought just some examples of what a unit looks like. This is a simulated one that we have in our program that I brought today, but this is what it looks like. And we generally talk about a pint of blood, but it's about 250 cc's, and that would be about like 8 ounces of blood, up to about 350 or 400. So about a cup and a half of blood. That's what we call red blood cells. When a person donates that much, we often encourage them to think about, well, we're taking that from your body, so you got to help replenish it. So usually before you donate blood, we encourage you to drink lots of water before, and then we will feed you afterwards to kind of help your body start to build the blood cells again. But it's about that amount, and then it is processed. So we usually call it a pint of blood, but it really varies from roughly about 240, 250 up to about 400 milliliters of blood.
Okay.
That's in each unit.
Good. About how long does it take to get that much blood?
Well, got a good blood pressure while you're sitting there and you're pumping your hand good, it takes about 40 minutes. About 40 minutes. So, you know, for some people it might take an hour, but we don't just let you get up and jump up. You will be a little bit lightheaded, so we set you up slow. And like I said, we get you drinking while you're there and watch you about 30 minutes afterwards. So we feed you something, give you some snacks. We're going to be having some sandwiches there, and hopefully when you walk away you won't be dizzy and that kind of, but that's usually one of the things where we take blood off. Some people get a little lightheaded, but we watch you very closely, and that's why as the students that are there, we're not the ones drawing your blood. You have a professional who does this all the time from the American Red Cross. Our students are your escorts. They are with you, they make sure you feel good, they help feed you, they help get you checked in. We're there as all the volunteer services. So you'll have experts who are able to take this blood safely from you, and then we kind of, like I said, make sure that you're safe afterwards. Like I said, the most side effects from giving blood is that lightheadedness that's very transient, and the other one, you might end up with a little bit of bruise where they put the needle in. But other than that, it's pretty innocuous, and I won't say it doesn't hurt to have the needle put in. I wouldn't want to lie to you. It does. That is a discomfort, and you'll have to face your own fears of how you feel about needles, but we have some very skilled people that do that actual removal of the blood from your body. So
Good. Another question that I had is, how often can someone donate blood?
If you donate blood, it would be 56 days before you would donate again. Now, we can just take platelets from your body and return the red cells back to your body, and with that you can actually donate every week when we just take the liquid part, up to 24 times I think in a year. So platelets is a little bit different. It is part of our clotting factor, helps us our blood clot, and sometimes we will collect just that product from you. But if you're giving the red cells, all the liquid with it, then it's 56 days.
Okay. Well, explain to me about this. How do they just get the platelets? And then what happens to the red blood cells that were taken at the same time?
They have a machine, and they'll actually have some of those machines here. So as they're drawing it out, it centrifuges it or spins it where the red cells separate, and then they collect the platelets and the plasma, and then they put that red cells back into your body, and you'll continue to use those red cells. It doesn't damage them, and you'll replace your own fluids back with the consumption of water in your own body processes. And so if it's then collected, and it's a wonderful machine, but they're going to bring a couple of those, so they can do that. And they also have a one where they call a double donor, where they take twice the red blood cells and give you back your plasma, which but we have to have certain clientele. We usually look at our big burly guys. We wouldn't do that to a little 100-pound woman, but a bigger guy who has a good red blood cell count, we can take twice as much red cell, giving back his plasma, and we can actually get 2 units off. That does prevent him from donating every 56 days. He has to wait 112 days to donate again, but he's actually helping 2 people with 1 donation. So kind of a neat aspect to that.
That's great. I was wondering, Gay, if you could just take us through from the moment somebody comes in and checks in to the time that they leave, so that someone feels a little bit more comfortable about donating, so they don't have that fear there. So,
when they arrive, there is a registration table which you would sign up for. If you've already pre-registered, you immediately would come in and be in the receiving area. You will complete a form updating of any health changes or any concerns, and then one of the professionals from the Red Cross will sit with you in a confidential area and clarify those concerns. They will take your blood pressure, they will check your pulse, and then they will check your hemoglobin and hematocrit. That's your blood count to tell us, is it high enough for you to be a donor. Once you've got through all that, then they take you into an area where you're going to be reclining on a cot, and they will then determine which arm would be the best or the best vessel, and they would access that. While you're there, they monitor how you're feeling. They usually give you a ball to help pump your hand. That helps the circulation so they can collect it. And you'll see your blood collecting in a bag like this, and it'll be kind of right beside you. Once it's done, then they remove the needle, put that dressing on it. They do encourage you not to use your arm for a little bit so that will not continue to seep a little bit. And then we slowly get you up, let you sit there, and then we take you to a little rest area, and we encourage you to drink and eat something, and then in a little bit you can be on your way.
And someone can drive themselves there and then drive home. They don't
That's
need
right.
someone else to take them.
Nope, should not have any problems along that line. The only thing we may is just make sure you're not lightheaded when you leave. So sometimes that takes a little bit. We got to get fluids into you. So usually if you drink a couple of glasses, we have orange juice, we have, you know, water, tea, those kind of things. Those things will replenish the liquid that we're taking from your body. The loss of this much red cells is not going to affect a majority, I'm talking 99% of us, is not going to impact us. We would not take blood from if you were not in a safe range. So
Okay.
it would be turned away and maybe to return at another time.
Okay. And again, the blood drive is when?
November 10th. It's a week from like yesterday or last Thursday, but November 10th is on a Thursday in the Parker Student Union down in the basement from 9 in the morning, 3 in the afternoon. So,
Okay. And the Parker Student Union is on the main campus of Hutchinson Community College.
Immunizations, and one of the things we didn't really mention was traveling out of the United States. There are some restrictions in reference if we've traveled through a certain time period, and some of those are, you know, back in the 80s to 96. There's so many things that are specific. It's pretty intricate. So if you've traveled internationally, you may want to be sure that you meet the parameters. And I know one of the things that the Miss Green from the Red Cross, is the lady I work with, said if students had been to Cancun in the last year, they could not donate. And again, they'd had lots of illnesses and things down there that they would recommend that they would not donate for a year. So that's one that she brought to my attention because I was dealing with college students, and some of them do go on spring break down there. So that would be one. But there are different ones across the continent that number would be recommended. So again, the number is 1-866-236-3276. And they're very helpful in giving you information.
Good. Just one last question, Gay. Who is served by the blood that we give here in our area?
Okay. Well, it can move across the whole state of Kansas. It is designed to serve, Wichita covers the whole central part of Kansas, going clear north and clear south. I know Salina has another center there, but blood can be distributed. So let's say Hutchinson had a big demand, even though it's sitting in Wichita, and maybe they're dealing with somebody, blood could be brought to them. So it is distributed to the many hospitals across our community. So it majority, you know, stays in Kansas to help Kansans. And a lot of people just think, well, it's just for surgery. And no, it's not for surgery. We have people who have cancer that in their chemo has destroyed their ability to produce red blood cells for a period of time. We have to give them blood. We have children with illnesses. We have people with born with different problems that will need to be treated with donations. So it's not just for surgery or for trauma people, victims, but it is used for many, many things across our community to help people live quality lives.
Well, Gay, I really appreciate you being here today, telling us about the blood drive, and if anyone in the community would like to come on November 10th between 9 and 3 to the Parker Student Union, we'd be happy to have you.
You betcha.
So thanks very much for tuning in.